Hello friends, if you feel knee pain is a problem only related to old age, then you should think again. A lot of patients are coming to my OPD these days in their 30s or 40s and complaining of knee issues. Hi, I am Dr. Himanshu Tyagi, Head of Spine and Orthopaedics at Fortis Hospital, Delhi NCR. And today we are going to talk about young age knee problems or Gen Z knee problems. First of all, why is the incidence of knee pain increasing in people less than 45 years of age? Most common reason is sedentary lifestyle. When you're sitting for long hours, you're doing excessive screen time, lack of physical activity, ultimately everything leads to weakening of muscles. Secondly, if you are obese or you are having a lot of body weight, extra body weight puts a lot of pressure onto the knee and that damages your cartilage. Thirdly, if you are not doing physical fitness exercises, like if you are trying to avoid even simple things like climbing stairs in your office and you are using an elevator instead, that also weakens your knee muscles and devoids your knee of the essential exercises that you should do for your knees. Next, if you are not using proper techniques in your gym, like if you are sitting wrongly in your gym or bending down wrongly in your gym, that can lead to early cartilage or ligament damage. Except for that, lack of basic activities like squatting down also weakens the muscle. Like in India, we earlier used to use a toilet seat that was on the ground, but now we are using a Commode chair. Now, when you are sitting down on the ground for your normal daily bathroom, then when you are sitting down, the muscles around the knee, they have to work when you get up or when you sit down in that position for long. So that is a sort of exercise. But when you are sitting comfortably on a Commode chair, then that basic exercise is not required. So you are just sitting on a chair and then you are getting up. So that amount of muscle strength is not happening. So overall, those simple exercises like climbing stairs or using Indian type of toilet seat can also help you in building up muscle strength. Also, when you are going for sports, sometimes if you are going without a proper warm-up, then also you are putting your knees on danger. Also, if the posture is not good, like if you are working in an office and you are not using a proper office chair, then also you are putting your knees at risk. Like if somebody is working from home and using a sofa to sit and always sitting with your legs folded, that also puts too much pressure on your knees. So if you do it for a long period, then of course that can damage the cartilage of your knee. Next important reason is if your diet is deficient in protein, vitamin D and calcium. So these are few basic reasons or flaws that we are following in our early age. All these are leading to knee pain. So now what are the common red flag signs that you should know? First is, if your knee starts paining when you are climbing stairs and your age is less than 45, you should definitely see a doctor. Second, if there is clicking or grinding sounds in your knee whenever you are making a movement. Third, if there is swelling around your knee after a short walk. Fourth, if there is pain during squatting or gym exercises, like if you have to get something from the lower shelf in your kitchen, you are squatting down and when you try to get up, you get pain. This is not acceptable below the age of 45. Next is when there is a feeling of instability in your knee. That means you feel that the leg bone and the thigh bone, they are not coordinating together, that some amount of instability is there. Then also it is important to meet your doctor. Or if simply you are trying to sit cross-legged on a floor, like for some puja, and you are not able to do it, and you are young, then also you should consider it seriously. So some of the prevention tips are, you should stay active. You should do some form of exercise like 30 minutes of brisk walking every day for 5 days in a week, or cycling or swimming, or at least you should do simple stretching exercises or some form of yoga. Next, maintain a healthy body weight. Less weight means less pressure on the knees. So you should cut down on your fat and sugar and try to maintain a healthy body weight, especially after the age of 40. Next, your diet should be good in protein, calcium and vitamin D. We have videos on our YouTube channel to guide you through the diet that you can have for stronger bones, especially vitamin D and calcium, and also high protein diet. You can look out for those videos in the description and then follow that kind of diet for healthy bones. Also, you should do regular warm-up and stretching, especially if you are going to gym, then warm-up is very essential. And if you have a sitting job at your office where you have to sit for 8 to 9 hours per day, then of course you should do stretching in between. Also, try to reduce your sedentary lifestyle. Whenever you are working in the office for long hours, take a break every 20 minutes, climb stairs or move around a little bit so that your legs get the required stretching. Normally, treatment by medicines we do not recommend for young patients. We encourage them to modify their daily activities. If required, we ask them to go to physiotherapy or do exercises at home. But muscle strengthening is very important. Also, movement is important. So we encourage them to use stairs. We encourage them to reduce weight. We encourage them to do 10 minutes of daily exercises every morning. For that, you can see the video on our YouTube channel also. They should have a break every 20 minutes in their office. They should roam around and, if possible, climb stairs also. If there is instability in the knee or pain is severe, or if clicking noise is concerning you, then you should definitely see your doctor, who will get your X-ray or MRI done to see if there is any cartilage damage or meniscus damage or any muscle related issue. So if your pain is persisting for weeks, swelling around the knee is increasing, or your knee is unstable and you are not able to walk, then you should definitely see your doctor, get his opinion, because strong knees are built earlier in the life. The choice you make today decide how your knees will support you tomorrow. So don't think knee pain is something that can only happen after the age of 60 years. If you are young and you are suffering from knee pain, see your doctor and start working today. All the best.